Well, 7 months into the pandemic and with no end in sight, is it time to reevaluate the way we live with COVID-19? Some doctors are now convinced that the lockdown measures meant to protect us from the virus could actually be hurting us. Instead of sheltering all of us, should we just be sheltering some of us? Senior investigative reporter Bigad Shaban reports on a controversial approach to fight COVID-19.
I see no reason why swimming pools should be closed. Chlorinated water is like the best way to kill coronavirus.
Dr. John Ioannidis believes many of our current restrictions are unnecessary and not actually supported by science.
People going to the beach to enjoy nature, something that has practically absolutely no risk.
He's an infectious disease expert and professor of medicine at Stanford. Dr. Ioannidis and dozens of his colleagues at universities like Harvard, Yale, and UCLA say it's time for a more targeted lockdown, with stronger measures for the most vulnerable people and fewer restrictions for everyone else.
We know that 95% of the population has practically minimal risk.
Because of that, he believes most indoor facilities can reopen safely, including restaurants, bars, gyms, and even schools. So long as communities wear masks, social distance, and track any COVID-19 infections, Dr. Ioannidis believes many of our current rules should be lifted.
There are health officers all throughout the Bay Area that would argue these restrictions are actually saving lives.
I believe that many measures within the bundle of shelter-in-place do save lives. But there can be many negative ramifications and many negative consequences from stay-at-home and lockdown orders.
Phenomenal defense. You might want to turn to...
But major sporting events and large conferences should still be avoided, he says. And Dr. Ioannidis is also calling for stronger protections at hospitals, prisons, and nursing homes. The CDC found nearly a third of all COVID deaths in the U.S. were in nursing homes.
These are really disaster places when things get out of control.
Rather than just random sampling, he recommends frequent testing of everyone at those facilities, similar to what professional sports teams have been doing.
We know far better who we need to protect, but at the same time, the large majority of the population should be allowed to go back to their lives. So it's unlikely that in the current situation we are really saving lives. I think that probably we're killing people by following some of these measures forever.
Killing people?
I think eventually we do.
You don't want to run?
Courtney Patel is convinced her husband died because of fears created by the lockdown.
We kissed and to say goodbye, and he said, "I love you," and then he went down.
That morning, her husband Dominic suffered chest pains, but he refused to go to the hospital. Like so many people, he worried about catching the coronavirus.
I do think that messaging, played into that fear of and the reluctancy of just, acting on those symptoms sooner and even calling 911 sooner.
By nightfall, Dominic was in serious pain. Against his wishes, his wife called 911. As the EMTs prepared to take him to the hospital, Dominic died of a heart attack at home. He was just 38 years old.
Absolutely, we have seen the negative impact of people being fearful of medical care.
Dr. Chris Caldwell is chief of emergency medicine at San Francisco General Hospital.
Have you had patients die that you think likely may have survived had they come here earlier?
Absolutely, absolutely. And I would say it's not just a few of those. At least every week we are seeing somebody who is going to suffer and is suffering severe consequences from having delayed care for fear of coming to the hospital.
29% of Americans are avoiding or delaying medical care due to fear of catching the coronavirus. That's according to the American College of Emergency Physicians. But those who support a broad lockdown say it's the best weapon we have to fight COVID-19.
I want to tell you a little bit about this acceleration.
Dr. Sarah Cody is Santa Clara County's health director and recently told reporters she believed a lack of restrictions caused a summer spike in COVID infections.
I think that people got a sense that because things were open, that it was safe, right? But the truth is that COVID-19 is still circulating widely in our community.
We're kind of squandering the sacrifices that people made during lockdown.
Dr. Edward Melnick teaches emergency medicine at Yale University. He believes reopening too soon, even with restrictions for vulnerable people, is too risky.
If an elderly person or someone who's chronically ill has a really tight circle, they're more likely to come into contact, with somebody in their own household, who then brings the infection home.
But Dr. Ioannidis argues a more surgical lockdown can protect those who are vulnerable, while still allowing most other people to return to a relatively normal life.
We have to balance everything, and I believe that in the current situation, prolonged lockdowns are going to do enormous harm to health and more.
With the investigative unit, I'm Bigad Shaban.